Hello, I am Kelly. I am a registered respiratory therapist at rrtresults.com. We have personalized plans to help you pass the RRT and a review course coming up, so please come and check us out. We also have plenty of free resources. On our last video, we looked at an ABG and determined that it was an uncompensated respiratory acidosis. Now we're going to go over the respiratory steps you could do to treat this. Remember, this is just for educational purposes only. Whenever we look at any patient's results, we need to first assess if the patient is ventilating. We can do this by assessing their chest movement, respiratory rate, tidal value, and their PCO2. In this case, the PCO2 is high and it is uncompensated, so the person is not ventilating. We need to do this before we can go on to anything else. So now we need to go over some ways that we can increase ventilation. If the patient is on the ventilator, it's usually the easier way to do this. We can increase the respiratory rate, tidal volume, or take away some dead space. Dead space may be an HME, it may be a Ballard suction. If the patient is not on the ventilator or on non-invasive ventilation, we can start non-invasive ventilation or BiPAP. If the patient is on the BiPAP and is receiving non-invasive ventilation, we can adjust the IPAP upwards or we can lower the EPAP. So let's go over an example. You are caring for a 5'10" 32-year-old male that is receiving mechanical ventilation after surgery. The current vent settings are a respiratory rate of 12, a tidal volume of 450, a PEEP of 6, and FiO2 30%. The following ABG results just got back. The pH is 7.28, the CO2 is 57, bicarb is 23, the PO2 is 78, and the SPO2 is 94. Your options for answers are to increase the PEEP to 8, which would fix the oxygenation issue, but we want to fix the ventilation issue. You can increase the FiO2 to 40%. That would also fix the oxygenation issue, but not the ventilation issue. Increase the respiratory rate to 16. This would help ventilate the patient. Increase the flow sensitivity. We're not going to pick that answer. So the correct answer is to increase the respiratory rate to 16. One thing on the aTMC and clinical simulation is that they will give you answers that all treat the issue, but you want to pick the best answer. So the more important thing right now is the ventilation over the oxygenation, so you would pick the answer that deals with the ventilation.